Welcome to the deep dive. Today we're stepping into the world of animal lameness. Now, that might sound purely medical, but it's actually fundamental to an animal's whole life, really.
Absolutely. Just its ability to eat, it's very survival.
Exactly. Whether you're talking about, say, a domestic alpaca or a wild elk out in the mountains, being able to move properly is just critical.
And the impact is huge. For livestock, lameness really hits the economics, lower fertility, less productivity.
But for wild animals, it's even more stark. It directly threatens their ability to find food, escape predators, even reproduce. So what's our mission today? What are we digging into?
Yeah, so what we really want to unpack is the comparison between two pretty distinct families of hoofed mammals. We've got the Camelidae, your camels, llamas, alpacas, and then the Cervidae, so deer and elk.
Okay.
And, well, sure, both groups can get injured, suffer infections, have developmental problems, their unique anatomy, their physiology, even how they interact with their environment. It creates really different clinical pictures.
Meaning different diagnoses, different treatments needed.
Precisely. And understanding why they're different, that's where it gets really interesting. It's key to how we approach them.
All right, let's start with the Camelidae then. Llamas, alpacas, especially the South American ones. You often hear they have surprisingly few lameness problems. Is that true?
Well, there's some truth to that perception. They can be remarkably sound, but when problems do pop up, they're very often linked quite tightly to their specific anatomy.
Okay.
And this is crucial, the way they're managed, their husbandry, especially when they're kept outside their native high-altitude environments.
So tell us about that unique anatomy. You mentioned the padded foot.
Right. It's fascinating. They aren't true ungulates like a cow or a horse. They're in the suborder Tylopoda, literally padded foot.
Okay.
Each foot has just 2 digits, and they rest on this big leathery foot pad. There's a toenail or claw at the front, but it's not really for weight bearing, more for traction.
So they walk differently.
Completely. It's a sort of modified digitigrade stance. They're basically on the second and third toe bones, cushioned by this digital cushion underneath. Think more like a dog's paw structure than a hard hoof.
Huh, interesting.
Yeah, and this anatomy, plus, they tend to be quite docile, lighter animals. It actually makes them remarkably good orthopedic patients. They tolerate slings, splints, even managing on 3 legs pretty well sometimes.
Okay, so that unique foot sounds like it could also be where problems start. What are the common culprits for lameness in camelids? Let's start with the feet themselves.
You got it. The feet and claws are definitely a major source. And the #1 issue, especially for South American camelids living here in North America, overgrown toenails.
Really? Just overgrown nails. They seems almost too simple.
It does, doesn't it? But think about it. In their native Andes, they're on rough, rocky terrain. Here, they're often on soft pastures.
So the nails just don't wear down naturally.
Exactly. They grow faster than they wear. Then they start to curve, and this actually twists the joints in their toes outwards.
Ah, I see. That can't be comfortable.
Not at all. It causes chronic pain, they start walking funny, and long-term, you get degenerative joint disease. Arthritis, basically.
And it all stems from nails that are too long. Wow. So I guess the fix is straightforward then.
It is, thankfully.
Wow.
Regular toenail trimming is the essential treatment and prevention. You just need to trim the nail level with the foot pad. Sharp shears are best.
Got to be careful not to cut too deep, though, into the sensitive part.
Right. You have to avoid the vascular tissue inside. But yeah, simple, regular maintenance prevents a lot of suffering.
Okay, besides nail length, what about infections? Can their feet get infected?
Oh, sure. They aren't super prone to classic foot rot like sheep, maybe, but in wet, dirty conditions, absolutely. You can see things like interdigital dermatitis, that's inflammation between the toes,
Right.
or ulcerative pododermatitis, which is inflammation of the pad itself, usually if the skin gets broken by moisture or trauma. Foot abscesses are also pretty common. You'll see swelling, the animal will be clearly in pain, sometimes there's a nasty smell.
And how do you manage that?
First step is environment. Get them somewhere clean and dry. Then you'd clean the foot, debride any loose or dead tissue, use topical antiseptics, and maybe protect it with a bandage or a little booty.
Okay. Systemic antibiotics needed sometime.
For deeper infections, yes, definitely.
All right, moving up from the foot itself. Arthritis, the sort of wear and tear kind, that happens too.
It does, yes. Osteoarthritis or degenerative joint disease, DJD, common in older camelids, and like we just discussed, sometimes it's a direct result of years of bad alignment from those overgrown nails.
Makes sense.
And in dromedary camels, the big one-humped ones, they often get traumatic osteoarthritis. especially in the fetlock joints. Those are high motion joints that take a lot of stress when they get up and down, or if they're used for riding or racing.
So, treating that kind of arthritis, what's the approach? Pain relief mostly.
Primarily, yes. Managing the pain is key. NSAIDs, non-steroidal anti-inflammatories, are the go-to. Meloxicam is one that's used. There's published data showing it helps lameness in Bactrian camels at a specific dose.
Even orally.
Yeah, orally, about every 72 hours seems effective. Beyond that, you might consider things like joint injections, or even some of the newer regenerative therapies.
But there's another more serious type of arthritis you mentioned. Infectious arthritis.
Yes, septic arthritis. That's very serious, especially in young ones, the Crius. The infection usually gets into the joint through the bloodstream.
From where?
Often from an infection somewhere else, like an infected navel shortly after birth. Common bacteria are things like Mycoplasma, Streptococcus, Corynebacterium.
And how do you know for sure it's septic arthritis?
You need to do what's called an arthrocentesis, basically. Tap the joint, take a fluid sample,
Okay.
and you analyze that synovial fluid. In septic arthritis, you'll see really high levels of inflammatory cells, high protein. It confirms the infection.
And treatment. Sounds like it needs to be aggressive.
Very aggressive. Long courses of systemic antibiotics are needed, often based on culture results from that joint fluid. And joint lavage, flushing the joint out thoroughly to remove pus and infectious material, it's critical.
Wow. So young camelids, Crius, they can face other issues too, right? Developmental problems.
They certainly can. Angular limb deformities, ALD, are quite common in growing Crius. The most frequent one we see is carpal valgus.
Carpal valgus? Is that knock knees?
Exactly, knock knees. And the overwhelming cause, interestingly, is linked to vitamin D deficiency, hypovitaminosis D.
Vitamin D. Why would that be so common?
Well, it's a fascinating consequence of their evolution versus where they often live now. They evolved at high altitudes, lots of intense sunlight.
Right, near the equator in the Andes.
Precisely. So in more temperate climates, especially during winter months with less intense sun, they often just can't synthesize enough vitamin D through their skin.
And that affects bone growth.
Yes, it leads to poor absorption of phosphorus, which is crucial for bone, so you get defective mineralization at their growth plates, causing the bones to grow unevenly, leading to those angular deformities. It's essentially rickets.
So prevention and treatment involve vitamin D supplements.
Absolutely. Supplementation is key. And for Crius with severe or persistent deformities that don't correct with supplements alone, surgery can be very effective while they're still growing.
What kind of surgery?
Procedures like periosteal stripping, which stimulates growth on the slower growing side of the bone, or transphyseal bridging, which uses implants to temporarily slow growth on the faster side. It helps realign the limb as they grow.
Got it. And are there other birth defects you see?
Yes, occasionally you'll see things like flexural deformities where tendons are too tight or too loose, causing joints to be stuck in flexed or extended positions, patellar luxation where the kneecap dislocates, and sometimes digital anomalies, extra toes, that's polydactyly, or fused toes, syndactyly.
And one last area for camelids,
Huh.
neurological issues. Can they cause lameness?
Definitely. Neurological diseases can absolutely present as lameness, weakness, or incoordination. The big one to know about is the meningeal worm.
Ah, yes. Parallelophrostrongylis tenuis.
That's the one. It's actually a parasite of white-tailed deer, where it usually doesn't cause major problems. But if it accidentally infects a camelid...
It gets lost in the nervous system.
Exactly. It migrates aberrantly through the spinal cord or brain, causing severe inflammation and neurological damage. It's often fatal in llamas and alpacas.
A really serious threat. Are there others?
Sure. Things like listeriosis, which is a bacterial infection, polioencephalomalacia, often linked to thiamine deficiency, and viral encephalitis, maybe from West Nile virus or even equine herpes virus 1, can cause neurological signs that look like lameness.
Okay, that's a really thorough look at camelids.
Nah.
Let's switch gears now. Let's talk cervidae, deer, and elk. You mentioned earlier the context is really different here.
Hugely different. Lameness in cervids is, well, it's multifaceted. The causes, the implications. They vary dramatically depending on whether you're looking at farm deer or wild populations.
Also,
Well, think about it. For a wild deer or elk, severe lameness, that's often a death sentence. They can't forage effectively, can't escape predators. In a farm setting, however, it might be a manageable welfare issue, an economic concern, but not necessarily fatal immediately.
right. And anatomically, they're quite different from camelids too, aren't they?
Completely. Cervids are true ungulates. They have a cloven hoof, 2 main weight-bearing digits. Each one is encased in a hard, keratinous wall. It's a structure built for durability, for traction on all sorts of terrain. Very different from that soft, padded foot of the camelid.
So given they have hooves, are hoof diseases a big issue for them, like they are for cattle or sheep?
Oh, absolutely. Hoof diseases are a major concern. One of the big ones, especially in deer and moose, is laminitis.
Laminitis.
Uh,
Is that what horses get? Founder.
Exactly, same basic process, sometimes called founder or slipper foot in deer. It's often the primary cause when you see deer with really overgrown, deformed hooves.
What triggers it in deer?
Typically, it's a sudden change in diet. Usually a shift to feeds high and easily fermentable carbohydrates, think corn, grains, especially from supplemental feeding sites, and low in fiber.
Like people putting out corn piles in winter.
That can definitely contribute. It causes metabolic acidosis, messes up blood flow to the feet, leading to painful inflammation within the hoof capsule.
And the pain makes them lame.
Right. They're lame, they don't move as much, so the hoof doesn't wear down. Plus, the inflammation disrupts normal growth. The result is that classic elongated, curled slipper foot shape. Some mineral deficiencies, maybe copper or selenium, might play a role too.
Treatment seems tricky, especially in the wild.
Impossible in the wild, really. In farm deer, yes, you can do corrective hoof trimming, and crucially, manage their diet very carefully to avoid those high-carb feeds. But for wild animals, it's just not feasible.
There's another hoof issue making headlines, right? Elk hoof disease.
Yes, treponeme-associated hoof disease, or THD. It's a really severe, nasty, emerging infectious disease.
What does it do?
It causes severely deformed hooves in elk. They can become broken, overgrown. Sometimes the whole hoof capsule just sloughs off, leads to extreme lameness.
And what causes it?
It's strongly associated with treponema bacteria, similar to the ones involved in digital dermatitis in cattle. It's thought to spread through contaminated wet soil.
And treatment for wild elk.
Again, that's the critical issue. There's really no practical treatment for THD in free-ranging wildlife.
So it's pretty devastating for affected populations.
It can be. Other things like foot rot or abscesses can happen too, maybe after an injury or if they're standing in constantly wet areas. In farm deer, you can treat those with antibiotics, cleaning the area, maybe even amputating a digit in severe cases. But again, wild animals are a different story.
Okay, what about arthritis in deer and elk? Similar to camelids.
Yes, they definitely get arthritis too. Studies looking at skeletons of wild deer and elk show evidence of osteoarthritis, especially in the spine and limb joints of older animals.
And in the wild, that must really increase their vulnerability.
Massively. Reduced mobility means you're much easier prey. They can also get septic arthritis, infectious arthritis. Bacteria like Brucella can cause it. There's also an emerging concern about Mycoplasma bovis.
Isn't that mainly a cattle pathogen?
It is, but it seems to be spilling over into deer populations in some areas, causing quite severe pneumonia and polyarthritis inflammation in multiple joints.
Interesting. What about Lyme disease? Deer are famous for carrying the ticks. Do they get Lyme arthritis?
That's a great question, and it's kind of counterintuitive. While deer are crucial hosts for the ticks that transmit Lyme, they themselves are considered dead-end hosts for the actual Lyme bacterium, Borrelia burgdorferi. They don't typically show clinical signs of Lyme arthritis.
Huh. So they spread the ticks, but don't get sick from the bacteria itself.
Generally speaking, that seems to be the case. Now, in farm deer, if they get osteoarthritis, you might manage it with NSAIDs, similar to camelids. And septic arthritis needs aggressive antibiotic treatment, just like in any species.
Moving on from disease. Trauma, broken bones, that must be a huge issue, especially for wild deer.
Huge. Particularly deer vehicle collisions. It's a primary cause of severe, often fatal, fractures in wild populations.
And other causes.
Falls, injuries from fighting, especially between bucks during the rut, getting tangled in fences, lots of ways they can get seriously injured.
Treating a wild deer with a broken leg sounds incredibly difficult.
Exceptionally difficult
Oh, no.
and dangerous, both for the animal and the people involved. The big risk is something called capture myopathy.
What's that?
It's a severe metabolic disease triggered by intense stress, like being captured and handled. It can cause muscle damage, organ failure, and often death, even if the initial injury was treatable.
So trying to help might actually kill them.
Sadly, yes. That's why for severe fractures in wild deer, often the most humane options are either non-intervention, letting nature take its course, or humane euthanasia.
What about in farm deer? Can fractures be treated then?
Sometimes. If they're in a controlled environment, some fractures might heal with just strict stall rest. Fractures lower down the limb, distal limb fractures, can sometimes be managed with splints or casts, but it's still challenging.
Okay, and finally, neurological diseases again. Important causes of lameness in cervids, too.
Absolutely. We mentioned the meningeal worm P. tenuis earlier in relation to camelids. It's also a major problem for other aberrant hosts like elk and moose, causing severe neurological signs, including lameness and ataxia.
Right, because the deer are the normal host, but it goes wrong in elk or moose.
Exactly. Then, of course, there's chronic wasting disease, CWD.
The prion disease.
Yes, the fatal prion disease. It causes progressive neurological deterioration, a staggering gait, incoordination, weight loss.
Mhm.
Those are all signs, and they definitely impact movement.
Any others?
Brain abscesses can occur more often in bucks, maybe from fighting injuries around the antlers. Those can certainly lead to incoordination or lameness, depending on where the abscess is.
So bringing this all together now, comparing these two groups, Camelidae and Cervidae, what's the big picture? What are the key contrasts when it comes to lameness?
I think the contrast is really striking, actually, especially when you think about our ability to intervene. In camelids, think about the common issues: overgrown nails, angular limb deformities due to vitamin D. These are often directly related to husbandry, right? How we manage them.
And they're often preventable or treatable?
Exactly, with a pretty high success rate. Plus, their generally docile nature makes veterinary procedures much more feasible. They're good patients, as we said.
Whereas with cervids,
It's often a far more complex and, frankly, often a much graver situation. In farmed settings, yes, you have issues like laminitis linked to intensive feeding, but even that's hard to manage sometimes.
and in the wild.
In the wild, lameness from severe trauma, from something like elk hoof disease or even advanced arthritis, it dramatically cuts down an animal's chance of survival. And on top of that, you have their inherent stress response.
The capture myopathy risk.
Precisely. It makes treating any condition that requires catching and handling them a very high-risk proposition.
So it really highlights a fundamental difference in approach.
Absolutely. It underscores why we need a species-specific approach. For domestic camelids, the focus can really be on proactive husbandry, prevention, and direct veterinary treatment when needed. It's almost like a partnership.
But for wild cervids,
For wild cervids, management often has to shift focus. Population health, disease surveillance, like for CWD or THD, becomes more critical. And there's the sober reality that for an individual lame animal in the wild, sometimes the most humane path is non-intervention, letting natural selection play out.
it's a tough reality.
It is. And it raises a really important question, I think, for all of us to consider. How do our interventions or our decisions not to intervene in the lives of these animals reflect our understanding of their biology, their natural instincts, and the wild environments they evolved in? Are we always helping in the way we think we are?